If we are to realize our aspirations for this year, we must do a number of things. We must unite to overcome the grave and persistent deepening crisis that our country faces and our people face, which is the coronavirus pandemic. But the pandemic in our country is now at its most devastating. The number of new infections, the number of hospital admissions, and the deaths that continue to take place have become far higher than it has ever been since the first case was recorded in our country in March of 2020.
In a nationwide address, President Cyril Ramaphosa announced that in light of a spike in COVID-19 cases in South Africa, the country will close the 20 remaining open land border posts with neighbouring countries for general entries and departures until February 15th. He made it clear that coronavirus vaccines will soon be available to the South African public. The country has chosen to buy vaccine supplies through the multilateral COVAX scheme, which will cover about 10% of the population.
We have put in place a comprehensive vaccination strategy to reach all parts of the country, and we continue to work on this strategy, ensuring that it will be effective. This will be the largest and most complex logistical undertaking in our country's history. It will be far more extensive than our HIV treatment program or even our national, provincial, as well as local government elections in terms of the number of people who have to be reached within a set period or space of time. It will require the active involvement of all spheres of government, all sectors of our society, and all citizens and residents of our country. Our strategy has several parts to it. The first part of our strategy is to acquire enough vaccine doses to reach this population or herd immunity. As the chair of the African Union, we initiated the establishment of an African Vaccine Acquisition Task Team. Having developed a clear strategy on vaccines, we realized that what we now needed was to go and acquire the vaccines. These will be purchased in bulk, and African countries will be able to order vaccine doses from the pool that we've created at the African Union level.
The new virus strain is making an already dire situation worse, as Gauteng province, the country's most populous, which includes the cities of Johannesburg and Pretoria, see hospitals such as the Steve Biko Hospital at a capacity and overwhelmed, as some patients are even being treated on fields outside hospital buildings. South Africa has reimposed coronavirus prevention restrictions such as banning alcohol sales, closing bars, enforcing a curfew and limiting attendance at public gatherings, including church services and funerals. South Africa, which is currently battling its second wave of COVID-19, has 1.2 million confirmed COVID-19 cases.